Great. So it sounds like at least our audio is working. So that's really good news. I'm going to hand it over now to Alana Pfeffinger, who is going to give us some information about the webinar and what you can do if you're having technical difficulties.
Thanks, Vanessa. Before we give a quick update on recruitment for cohort number 3, I just wanted to let everybody know that we will keep you all muted throughout the course of the presentations. If you have a question during the presentation, please write it in the chat box, and we will address it during the Q&A portion of the presentation, which will start after Dr. Seligman's talk. If at any point you're having technical difficulties, please contact us using the chat box function. And with that, I want to give a quick reminder to all individuals on the call that we're very excited to be in the process of recruiting a new cohort of Champion Provider Fellows. This new cohort will be the 3rd cohort. To date, we've onboarded over 80 fellows. Applications for this year's cohort are due on Friday, December 14th. And for more information about the fellowship, information on how to apply, you can go to the website that is listed there. And with that, I'm going to hand it back over to Vanessa to introduce today's speaker.
So I'm going to introduce today's speaker, Dr. Hilary Seligman. We're thrilled to have Dr. Seligman on the call today to provide an overview of both state and federal policies affecting the Supplemental Nutrition Assistance Program, or SNAP benefits, better known as CalFresh here in California. As you listen to the presentation, please take note of the different potential action items for Champion Provider Fellows that have been outlined throughout. So it gives me great pleasure to give you some background information on Dr. Hilary Seligman. She's an associate professor in residence at the University of California, San Francisco in the departments of medicine and of epidemiology and biostatistics, where she directs the Food Policy, Health, and Hunger Research Program at the Center for Vulnerable Populations based at Zuckerberg San Francisco General Hospital. She's the director of the CDC's Nutrition and Obesity Policy Research and Evaluation Network, also known as NOPREN, and serves as the lead scientist for Feeding America, the nation's largest domestic hunger relief organization. She's nationally recognized for her research on the health implications of food insecurity in the United States. Her policy work focuses on federal nutrition programs, food affordability and access, and income-related drivers of food choice. In addition to research, she also founded San Francisco's fruit and vegetable voucher program, Eat SF. What you might not know is that Dr. Seligman was also the initial principal investigator for what is now known as the Champion Provider Fellowship. We are really grateful for her initial leadership around this fellowship, and also that she's still willing to share her time and expertise with this fellowship program. So with that, I'm going to hand it over to you, Hilary.
Thank you, Vanessa. I'm thrilled to be here today, and thank you guys all for your interest in this very wonky topic. I'm going to try to make it really relevant to the work that we do as physicians, but also try to fill in some of those black boxes that make it so difficult to understand why these policies are in place to begin with and why they are in play right now. I'm going to start with just 2 minutes, though, of level setting around SNAP and CalFresh. California SNAP program, as Vanessa said, is called CalFresh. That's a picture of a CalFresh card right there on the screen. There are 42 million Americans enrolled in SNAP across the U.S., but this number has been steadily declining as the recession has lifted because fewer people are eligible or needing benefits. But the people who remain in the SNAP program have a greater depth of food insecurity or more severe food insecurity, and it's lasting for longer. In California, about 4 million Californians are enrolled. That's about 11% of our entire population and about 70% of all people who are eligible for SNAP in California. And nationally, we spend about $68 billion on the SNAP program per year, most of which goes directly for the food value. In California, SNAP benefits cover about, on average, $149 worth of food purchases per month. That's about $5 per person per day. And SNAP is the only federal nutrition program that is an entitlement program with categorical eligibility. This means that everybody who meets certain thresholds in the United States is eligible for benefits. And those two major buckets of eligibility are you have to be a citizen or a lawfully present immigrant, meaning you can't be undocumented. Unless you are on disability or a child, and you have to meet income thresholds, and in California that threshold is less than 200% of the federal poverty line after deductions. We know that CalFresh and SNAP are very effective at reducing food insecurity, but because the benefits are relatively low and the most food insecure households are the most likely to enroll in SNAP, about 54% of households enrolled in SNAP are still food insecure. We know that SNAP is associated with better health outcomes. Children with access to SNAP are less likely to have stunted growth or heart disease or become obese, and they're more likely to finish high school. People enrolled in SNAP compared to similar people not enrolled in SNAP are much more likely to rate their health as excellent or very good. Elderly SNAP recipients are much less likely to report needing to skip medications, and they're less likely to use healthcare services. So we know that SNAP also reduces healthcare utilization. And when you cost all that out, a SNAP participant matched to a similar non-participant incurs about $1,400 less per year in healthcare spending, which really suggests that although SNAP is designed to support food security, it's clear that SNAP has profound health impacts across the life course as well. And this is why I think physicians across the United States, but in California in particular, have been really willing to engage in issues of nutrition, and particularly federal nutrition programs like CalFresh, as part of their work towards population benefits for their patients. So with that in mind, we're going to cover 5 buckets of information that are important changes and potential changes in the CalFresh program for the end of this year and the coming year. And those are SSI cash out, the issue of ABOD, SNAP work requirements, public charge, and then a quick update on the federal farm bill. And I'll give you 2 quick caveats, which is that I wrote this talk on the 26th and had to go back and edit today because things change super quickly. But also these issues are really complex, and there's often disagreement even among experts, and so I'm giving you my best parsing of the truth in the universe based on the way that I understand it. So let's start with SSI cash out, because this is a big, big issue for those of us here in California. So some background information. California's SSI program, Supplemental Security Income, began in 1974, and SSI is a cash aid program to adults over the age of 65 or disabled people. And the cash aid is primarily federal money, but the state is allowed to augment that federal benefit with what is called SSP, a state supplementary payment. There are currently 1.3 million Californians who receive SSI benefits, although the benefit rate is quite low, less than 100% of the federal poverty level, so way less than the average cost of living for someone in California. So what does this have to do with CalFresh? So to understand the cash out story, you have to understand a little bit of the history of SSI. In 1974, California, like many other states, implemented SSI and was allowed at that time to increase their state supplementary payment by about $10 a month to cover the value of the food stamps benefits. SNAP was obviously called food stamps at the time. And the states did this in order to save on administrative costs. It was clear that virtually everybody who would receive SSI benefits would be eligible for food stamps. So therefore, rather than administratively go to the effort to enroll them in both programs, let's just make the food stamps benefits part of the standard SSI benefit allotment. And so that made California SSI recipients ineligible for food stamps. It was considered double dipping because the value of the food stamps benefit was already in the SSI payment. That benefit, that state supplementary payment, has not increased since 1983, and that state supplementary payment includes that $10 worth of food stamps benefits. So it's not really true that SSI recipients are still receiving $10 a month in food stamps benefits, and that's considered their food stamp benefit for the month, but that is the way essentially that $10 got both encoded into the SSI program and made people ineligible for SNAP benefits. All other states eliminated the cash out program long time ago, but it was maintained in California despite many decades of advocacy because there were concerns that if SSI recipients were eligible for CalFresh benefits, the increase in income would throw other household members off of eligibility for SNAP and other benefits. So after decades worth of effort to get the legislation changed to eliminate SSI cash out, a new state policy was enacted in the 2018-2019 California budget, which was a little bit of a workaround for legislative policy. And that budget change will formally end overnight in the summer of 2019. The budget allocation actually says on June 1st or August 1st of 2019. And on that day overnight, an estimated 500,000 people in California will become eligible for food stamps benefits for the first time since enrolling in SSI. The state has set a target of getting 75% of these 500,000 people enrolled pretty much immediately, but all of these people are older adults and adults with disabilities, which means they have a lot of barriers to enrolling in CalFresh. And so simplified, streamlined, and tailored enrollment processes are really being recognized as the key to getting any of these vulnerable patients enrolled in CalFresh, much less 75% of them overnight. So on this issue, what can champion providers do? There's a big role for education here because there are very few people at this point who are aware of this change. There are also efforts at the state and the county level to inform everybody on SSI of their new eligibility status for CalFresh come next summer. But the details of that haven't happened yet, and there will be many people who likely will not be clear that they will suddenly become eligible for CalFresh benefits. For those people, there's going to likely need to be some support with CalFresh enrollment, which may happen through the food bank or it may happen through other resources. Particularly, some of these patients may only be able to get assistance if there's assistance provided in the clinic. And you can reassure patients that if they're concerned that other household members will lose benefits, because this was a big issue in the past, there is a grandfather clause in that budget policy that says that household members of SSI recipients newly eligible for CalFresh will not lose CalFresh benefits, at least for the next 2 years until they figure out how to resolve that issue. So these households are grandfathered into everybody in the household who would otherwise be eligible receiving CalFresh benefits, at least in the short term. The next issue is that of ABODs. ABOD stands for able-bodied adults without dependents. And again, we have to go back in history to really understand the origins of this ABOD issue. The origins of the ABOD issue was in the Personal Responsibility and Work Opportunity Reconciliation Act signed by Bill Clinton. This is more frequently called the Welfare to Work Act. And it was a federal regulation that stipulated that able-bodied adults without dependents either had to work or be excused from work for a specific reason, or they could only receive SNAP benefits for 3 months in every 36-month period. So essentially, this was a work requirement for SNAP benefits that was implemented way back in 1996. So why does nobody know that there are already SNAP work requirements? I'm sure you've been hearing about these work requirements in the news. How come nobody told us that we already had them? Well, essentially, the reason why nobody's aware of it is for the last 10 years, virtually every state and every California county had a waiver for implementing this part of the federal regulation based on the employment rate. And CalFresh in California is implemented at the level of the county. And so in California, this was based on the county employment rate. And during the Great Recession, the federal government allowed states and counties that had unemployment rates greater than 7% to waive this work requirement because there simply weren't jobs available. There are 3 counties in California that lost their waiver in 2018, San Francisco, Santa Clara, and San Mateo. And for these 3 counties, the ABOD rule went back into effect on September 1st. And it's expected that 3 additional California counties will lose their waivers next year and will essentially take effect September 1st, 2019, and that's Alameda, Contra Costa, and Marin. But if you aren't in one of those 3 counties, keep listening, because this still may impact you sooner than you think with the federal legislation. And we'll get there in a minute, so just put it in the parking lot for a minute. So the work requirements that are currently in effect say that people on CalFresh or SNAP benefits have to be working 20 hours per week or an average of 80 hours per month at one of these activities: working, in school at least 50% time or training, volunteering, searching for a job up to 9 hours per week, or workfare. And there has been broad recognition that in order to get people into workfare, which is a welfare for work training program, that we were really going to have to beef up our job training resources and our sites for allowing new work experiences as part of workfare. And so that's what led to the creation of the CalFresh Employment and Training Programming, which is being sort of revived in the context of these ABOD work requirements coming back into play. Now, one really important thing for you to know about the ABOD rules is that there are lots of exceptions. You are only potentially eligible to be kicked off of SNAP because of work requirements if you're between the ages of 18 or 49 years old, or if you don't meet all of these criteria that kick you out of the ABOD bucket. And those criteria that would kick you out of the ABOD bucket would include living with a child under the age of 18, caring for a young child or a disabled person, if you're chronically homeless, if you're physically or mentally unable to work, but you do not have to be on disability, if you're pregnant, if you're struggling with or in treatment for drug or alcohol addiction, if you're currently dealing with intimate partner violence, or if you're applying for or getting disability or unemployment insurance. Now, the key here is that some counties will have very good processes for trying to find the people who meet these criteria, and some counties will wait for people to self-disclose that they have one of these criteria, so they shouldn't be subject to the ABOD rules. So in one way or another, you will have to report one of these exemption conditions in order to receive an exemption. And some people are being asked to provide proof of the condition if it's available. So for example, proof of a drug or alcohol addiction, or proof of a physical or mental condition that would keep them from working. So this is a fixed clock. This is quite confusing, so I will do my best to explain it to you. It's a fixed clock, and everybody in California is on the same 3-year clock. And California's ABOD clock began in January 2017 and ends in December of 2019. And that means for all of the people in the 3 counties for whom the ABOD clock started again on September 1st of 2018, those not working or exempt from work can only receive CalFresh for 3 months between September of this year and December 31st of 2019, at which point in time the clock will reset for everybody in the state of California. So what can Champion providers do on this issue? The first is support and educate patients navigating the transition in the impacted counties. In particular, patients may need support identifying or providing documentation for exemptions, although some counties are being very accommodating in the amount of documentation that they're requiring. And ABODs may not realize it if they're inappropriately not receiving an exemption. So my example here is, Mr. Jones, you should be able to receive CalFresh benefits with your pulmonary hypertension, but it need not be something as big as pulmonary hypertension to get you exempted from the ABOD rules. There will be a subset of people who will lose their benefits very soon in these 3 counties because of this new ABOD rule, and those people will probably need to be referred into community food resources if they don't have other strategies for covering their monthly food budget. And again, this is an issue where very few people are aware of what's been going on. The policy issues are complex, so you can also be a resource for educating colleagues on what needs to be done. So how does this fit into the federal SNAP work requirements? And we'll come back to the big picture on the federal Farm Bill, but just to keep in mind the big picture on work requirements, the House and the Senate have both passed their version of the Farm Bill, and the stage it's in currently is that the House and Senate versions have to be reconciled so that everybody can vote and agree on a single Farm Bill. SNAP work requirements are in the House version of the Farm Bill that was passed, but not the Senate version, and there's 2 fundamental changes that have been proposed. The first is to expand work requirements to a larger population than the current able-bodied adults without dependents. And the second is to make penalties for non-compliance harsher. And the expanded eligibility really covers a couple of buckets. The first is it would expand the time limits to adults 18 to 59 instead of 18 to 49. It would exempt from time limits households with children less than 6 instead of exempting from time limits households with any children. Remember, in the current work requirement rules, if you had any child under the age of 18 in your household, or you were caring for a child under the age of 6, you were exempt. And this makes it so that if you have a household child between the ages of 6 and 18, you would no longer be exempt from work requirements. It would change the areas in which waivers would be available because of the unemployment rate from 7% to 20%. So there would have to be rampant unemployment in the area in order for a waiver to be put into place. And I want to emphasize here that one of the challenges to this waiver rule is that even in populations, in geographies where the overall county unemployment rate is quite low, like 3%, 4%, 6%, there still may be pocket populations of vulnerable adults where the unemployment rate is substantially higher, and this often happens in African American populations. An update that I had to add this morning is that it seems as if the crackdown on waivers may be the only proposal that makes it into the final bill, rather than state SNAP requirements more broadly. 36 states currently have waivers, including California, meaning that they don't have to apply the ABOD rules right now. Remember, every county in California right now, except for 3, currently hold those waivers. And 36 states in addition have those waivers. It looks like in the Farm Bill, the waiver crackdown may be the only part of this that gets implemented, which would mean that all counties in California would go back to the original ABOD rules that were in the 1996 Welfare to Work legislation. But all votes were canceled this week because of the death of former President Bush, and so we're still waiting for that final Farm Bill to be signed. So that's the first big issue. The second big issue that looks like it probably won't be in play anymore is harsher penalties, and I'm just going to skip that given that I don't think that it's going to be part of the final Farm Bill as of this morning. So there's lots of arguments for and against these SNAP work requirements. The argument for is that SNAP recipients should work towards economic self-sufficiency, particularly if they have no reason to not be working. The arguments against it center around a couple of different buckets. One is the lack of availability of jobs, and in particular, the volatility in low-income job markets makes it very challenging for people sometimes to reach the 20 hours per week, even if they do have a job. Other arguments include stigmatizing SNAP participants and allocating inadequate funding for the employment and training that would be necessary to get all of these SNAP recipients trained for existing jobs. There has been included in the Farm Bill federal grants to states to massively increase SNAP employment and training programs. But it is still felt as if the $1 billion that were allocated in the current version of the Farm Bill being negotiated would not be enough. So the SNAP work requirements have been a particular point of contention in the Farm Bill renegotiation, partially because there's a big partisan divide with Democrats not supporting SNAP work requirements and Republicans supporting them. And also because it's really challenging to save money in the Farm Bill if you don't start attacking federal nutrition programming, because the vast majority of Farm Bill expenditures are put out towards federal nutrition programming. So there just aren't many pieces of the pie left if you take federal nutrition programs off the table. And so this is why nutrition programming is so prominent with every Farm Bill renegotiation. So what can you do? Farm Bill renegotiation obviously is happening right now, so it's a good time to reach out to your elected officials. It's a good time, particularly for op-eds, particularly in districts where candidates support SNAP work requirements, but this is obviously up to your capacity to do it and willingness to stick your neck out on this particular issue. The next issue that we're going to cover from the perspective of federal nutrition policy is the issue of public charge. And I suspect many of you have some awareness of the public charge issue, but I'm going to try to level set this issue a bit as well. So the public charge test has been part of federal immigration law for decades, and it identifies people who depend on government benefits as their main source of income and allows those people to be refused permission to enter the U.S., that is, get a U.S. visa, or to get a green card to become a lawful permanent resident under the assumption that they could become a burden on the federal or state government were they to become a permanent resident of the United States. So this has been in place for a long time, and under current policy, the only benefits that are taken into consideration in assessing the degree to which a person may become a public charge were cash assistance. SSI, which remember is not that much money, less than 100% of the federal poverty line, TANF, which virtually nobody gets anymore, and government-funded long-term institutional care. The people who are not eligible for the public charge test include people who are refugees or asylees, and really importantly for us to understand, at least from a policy perspective, is that once you have your green card, once you are a lawful permanent resident, that public charge test is not supposed to apply to become a U.S. citizen. So on October 1st, the Trump administration formally announced a dramatic broadening of the public charge test from someone who was relying on the government as their main source of support to someone who participates in any government support programs, even if they're eligible for such programs. So it took it from a small number of programs, SSI, TANF, long-term institutional care, to all kinds of benefits to include SNAP or CalFresh, Medi-Cal, Medicare Part D, and Section 8 housing. The Children's Health Insurance Program was also considered at one point to be in this bucket of benefits, but it has been removed from the bucket. The public charge test under these new rules that broaden the definition of public charge also gives negative weight to households with children or seniors, households with poor health, households with limited education or limited English proficiency, a poor credit history. You can get dinged for having a large family, and you can get dinged for having a low income, even if that income is up to 250% of the federal poverty line. So there are lots of things in here that dramatically expand that definition of who would be considered a potential public charge. That being said, this rule, from an actual policy perspective, it's thought that this rule would likely, in reality, impact very few people, because it's just those people who are applying for a visa or a green card. The big issue, and the reason why it's gotten so much attention and press, is that even without implementation for anybody, even with just discussing it, and even with just those people who are applying for lawful permanent residence or for a U.S. visa, it's already had what's called a great chilling effect. And that is that people are so concerned about the implications and the stigma and the ability of the federal government to be able to identify people who are using benefits, that the enrollment is already being severely impacted, even among populations that are not likely to be impacted by the public charge rule. So, for example, people who are already documented citizens or mixed documentation status households. The first official academic data about this came from this year's American Public Health Association annual meeting, which showed a substantial drop in SNAP enrollment among immigrant mothers who'd been in the U.S. less than 5 years, from 43% to 35%. But we've seen similar things locally, where I've talked to local implementation officers who are also seeing dramatic pullbacks in people coming in to apply for benefits, and even more concerning, people on benefits presenting at the CalFresh office, for example, and asking to be disenrolled. And I want people to just remember in this context that besides SNAP, this is also likely to impact Medicaid enrollment, because Medicaid or Medi-Cal is also included in that bucket of benefits. So here is a place where champion providers can make a big difference. The public charge comment period is open until December 10th. Every comment has to be read. Unique comments are given more weight. And by unique comments, we mean comments that are at least 2/3 different from a template that you may have received in your email. If you feel so inclined, the best website for information and for actually submitting comments, or a website that you might use, is Protecting Immigrant Families. It has a lot of really excellent and well-verified information, and it allows you to input your public comment right into their website, and it will be sent to the Federal Register. The big hope here is that there are at least 150,000 comments across the U.S. that are submitted, because the best that many advocates think that they can do at this point is to delay implementation of the rule. And the more comments that are submitted, the more time it takes to go through them, and the more it delays implementation and allows advocates and other policymakers to create reasonable workarounds. So it's still unclear here what advice clinicians should be giving patients, and I've asked up and down the line for that advice, because it is unclear whether it's safe to reassure patients, and we don't want to be telling people unnecessarily to withdraw from benefits. So really the important thing is to talk about this issue with colleagues and with the leadership of your health system, and to be very aware of how much fear is being sowed among this very vulnerable population group, even among people who may not be, for whom the public charge rule may not be actually applicable. Obviously, even for people for whom it's not applicable, it's often applicable for people, or it can be applicable for people in the family. And then finally, I'll spend just a few minutes talking about the federal farm bill. As of the 26th, when I pulled these slides together, it was less than 3 weeks until Congress planned to adjourn for the year. It's now less than 2 weeks. The House and Senate versions still have not been reconciled, although apparently a final version is finally now undergoing the process of being rewritten. There are very few voting days left in session, and so it's been a big issue how this farm bill is going to get signed before Congress concludes for the year. Work requirements had been the biggest partisan sticking point, but you know, you never know what's going to happen. Forestry regulations and wildfire prevention became a big issue that was taking up a lot of time over the last week, and so it sort of delayed discussion of SNAP work requirements for a number of days. So what can champion providers do on this issue? The federal farm bill negotiations are mostly out of our hands at this point, but again, op-eds can be effective, and directly reaching out to your elected leaders can always be helpful. So I'm happy to answer any questions. I left plenty of time at the end knowing how complex these issues were, and I'm just going to put the language up here just because remembering the names of these things can even be helpful. And with that, that's the end of my formal comments about these 5 issues.
Great. Thank you so much, Hilary. Thank you to Dr. Seligman and also to all of you who took the time to listen to Hilary's presentation. We have time now for questions from you all. The way that we're going to do those is for you all to type them into the chat box function to ask your question, and then we'll go ahead and read those questions out loud and ask Hilary to answer them. So if I'm going to give you all, I don't think we have any questions yet. I'm going to give you all a few minutes to be able to type your questions into the chat box function.
And while you're doing that, I'll say that I pulled a brief. I tried to find very brief resources on each of these issues except for the federal farm bill because that was moving too fast from the perspective of California or public health, and those handouts are attached to the GoToWebinar, so you can download those if you would be interested in learning more about any of these issues.
And great, thanks so much. That'll be, that was one of the points I was going to make as we wrap things up, but a full recording of the webinar, including the PowerPoint and handouts, are going to be available online for everybody to access if you want to see Hilary's slides or reference any of the references that she's pulled together. So thanks so much. We have one question from the audience about the specific effects of some of these different changes on students. And I know at our university, we see a lot of students who are living with food insecurity, and for folks who are under the age of 18, those numbers are even greater. If you could comment on the specific effects on students, that would be helpful.
Yeah, so let me start with the public charge rule. There was a lot of fear in the initial out of the public charge rule that receipt of free or reduced lunch and breakfast through the National School Lunch Program and the School Breakfast Program would be impacted by the public charge rule, which would essentially mean, you know, virtually every student in California. The actual policy, as the way I understand it, does not spell out any actual programs that would officially included, but there has been discussion with the federal government where it has become pretty clear that they do not intend to include school lunches and school breakfasts as part of the public charge rule. But again, that's an issue where I wouldn't test 100% because it's not spelled out, as far as I know, in the existing documentation. For the public charge rule, I think this is a big issue, is immigrant families losing access to their SNAP benefits. And this is where we really worry about the long-term health implications for children, and also the long-term implications on cognitive development, which downstream implications for success in school, graduating from high school, going to college, maintaining steady employment in the future. So that is really where we think. In terms of community college and college students, the ABOD work requirement rules exclude people who are in school full time, or at least more than 50% time, but it is going to be a challenge, particularly for documentation and for, well, let me just say for documentation first, for people who are in community college or four-year college and do not meet that 50% rule. And the reason why I'm stuck here a little bit is that for many people in low-income populations, the school is often something that fluctuates a lot. Your numbers per semester. There also may be a number of things that fluctuate within the semester where classes are dropped, particularly for students who are in school and community colleges. And so that's one of the reasons why these ABOD work requirements are considered so challenging for low-income populations, is that there's so much volatility in the number of hours. In terms of WIC, WIC is already a program that allows all comers who meet income thresholds to receive benefits. So you do not need to be documented in California or in the US to receive WIC benefits. So again, this is a place where if there's an impact from the public charge rule, it is from the chilling effect, not from the actual implementation of the policy, which many people say is the intention of the public charge rule. But you do not need to be documented to get WIC. The reason that is that in the historical arguments for establishing a WIC program, it was understood that nutrition early in life and in utero was essential for children to reach their academic and cognitive potential, which was essential for people becoming economically self-sufficient. So there was a financial argument made that even undocumented children, if they were going to be in the U.S. for the rest of their lives, needed access to WIC in order to avoid not being economically self-sufficient as adults. And I include that because I think it's fascinating in the context of how the SNAP debate has evolved very differently.
I think there's also a question that's been typed here, and thanks so much, Dr. Pendekar, for being so, for having some questions about Hilary's presentation. But one of the questions is just about that unemployment rate, that 20% unemployment rate, and really whether or not, I mean, you talked about micro communities within counties, but are there specific counties that reach that 20% unemployment rate in California? And if not, are there other ways that that rule is going to potentially be implemented?
So my reading between the lines here is that raising that employment threshold to 20% will essentially make no county in California or state in the U.S. eligible for a waiver from the ABOD rules. So essentially it would reinstate those initial ABOD rules from the Welfare to Work Act back in the 80s for everybody in the U.S. And so would it prevent more people from using SNAP? Absolutely, because it would off the program after 3 months. Everybody who was considered an able-bodied without dependent children.
Oh, thank you. And then I have one other question, and this is from me, Vanessa. Personally, I had somebody come into my clinic and asked me to complete one of these forms for them to continue to be eligible to get these benefits. And I was just wondering about the 9-hour work, like looking for work. Is it 9 hours and then you have to make up the other 11 hours to get to 20 hours with some actual work, or is the 9 hours is equivalent to 20 hours of actual work?
My understanding of this is that of those 20 hours, you can claim that 9 of those hours were you actually looking for work, but you can't say, oh, I spent 20 hours last week looking for work. You can only count 9 hours towards the job search. That's my understanding of that rule. If anybody else on the call has any other understanding of that, I suppose that I may have misunderstood that. So still 11 hours of work you would have to do outside of your job search or volunteering. I'll say one other point about that, which is that there has been some interest in some places in addressing this by becoming workfare sites themselves. So creating opportunities for people to do job training or job services within the healthcare sector has been one way that health systems have been trying to support this work. Although there are a lot of challenges in developing and maintaining those programs, it's another idea to think about.
Thank you so much. Does anybody else have questions while we have Hilary on?
I see another question here. Who determines eligibility? Does it fall upon the county SNAP program? The individual counties in San Francisco, I'm sorry, in California have responsibility for figuring out who is eligible for the SNAP work requirements, or who is an ABOD and who qualifies for an exemption from being an ABOD. And my county, and I presume that the other 2 counties, but I don't actually know for sure, but San Francisco County has been very proactive in helping people to identify if they have an exemption. So if you walk into the San Francisco CalFresh office and you're potentially an ABOD, you will be given a list of exemptions and you will be asked, do any of these apply to you? So of course you have to be able to read to fill that paper out and to qualify for an exemption, but they're really working hard to try to support people who shouldn't be eligible for the ABOD rule from inadvertently being put into that ABOD bucket. It isn't clear to me how other counties will be implementing that, and I will tell you it takes a lot of work on behalf of the county CalFresh office to do that screening. It's much easier for the CalFresh office to just say, I'm sorry, you're no longer eligible for CalFresh benefits. And so it's really reliant on the county office stepping up and deciding how challenging or not challenging they're going to make it for people to get out of the ABOD work requirement. And if this question had to do with who determines eligibility for CalFresh more broadly, it's the same eligibility worker in the CalFresh office that's doing the screening for income, for citizenship, for deductions, et cetera, who will be doing the ABOD eligibility screening as well. So the question is, so locally the county office can help the folks who need access to the program instead of relying on the feds. Yes, that is correct. CalFresh is a federal program that is implemented at the state level. And in California, the state has relegated implementation to the level of the county. So we essentially have almost, 50 some odd CalFresh programs in the state of California that are all implemented a little bit differently. And those decisions about how eligibility works and what the office looks like and what paperwork you get, all of that is different from county to county. And this is the reason why in California, unlike in every other state, the waivers for SNAP work requirements, for example, are happening at the level of the county rather than at the level of the state. We are the only state that does it this way. But the office that you would go to in order to enroll for CalFresh or to state to CalFresh that you have an exemption and shouldn't be eligible to the ABOD for the ABOD rules, all of that implementation work is done at a county office.
Great. Thank you again so much. I'm going to give one more minute while to see if anybody else has questions. And while we wait, I did want to point out that if you were watching the slides throughout the presentation, there were a number of points where there were specific suggestions for champion provider fellows to intervene on these different topics in their communities. So just encourage you, if you are feeling energized by this presentation, which I know I am, as I've already pulled up my protectingimmigrantfamilies.org website, that there are a number of ways that Hilary has suggested that we can get involved to try to move the needle on some of these policy issues. It's really, this presentation highlights the way in which the work that we do at an individual patient level is really so tied to broader policy issues, and that our voices are really needed to move the conversation in the direction that we want it to go. So since there are no other questions, I just want to say thank you again to Dr. Seligman, to our colleagues at the California Department of Public Health, and all of the champion provider fellows and local health department representatives that were able to make it on the webinar today. We also appreciate individuals from our partner organizations for joining us. So thank you very much for that. I mentioned already that we'll have a full recording of the webinar available, as well as the slides. And just one more plug, which I know we've been doing a lot of lately, but we're really excited to onboard a new cohort of champion provider fellows this spring, and wanted to highlight that we are looking for the applications with the deadline of Friday, December 14th. Any questions at all about the process or any problems that you've run into, we and our colleagues at Brown Miller Communications are happy to answer your questions and help you navigate help you navigate the application process. So please do reach out. And with this, I will conclude our webinar. Thank you again.